Hello, my name is Dr. Brady Wyrick, and I'm a board-certified chiropractic neurologist. I've been in private practice now in East Idaho for the last 4 years, and have been successfully treating autoimmune conditions since then. Today we're going to talk about autoimmune conditions, what that means to you, and how we successfully treat these conditions without using drugs or medication. Now, first of all, what is an autoimmune condition? Well, the definition of an autoimmune condition is that it is a condition where your own immune system, which is designed to keep you healthy, which is designed to fight off foreign invaders, your own immune system goes awry and it attacks this very specific part of your body. Now, there's several different autoimmune conditions out there. There's thousands of autoimmune conditions that don't even have names. They just attack different parts of the body. But just for example, there's rheumatoid arthritis, which is an autoimmune condition where your immune system is attacking your joints. There's Sjogren's syndrome, where your immune system is attacking your lacrimal and your salivary glands. There's lupus, which attacks skin, joints, kidneys, etc. Scleroderma, attacks your connective tissue syndrome. And when we have Hashimoto's disease and Graves' disease, which are both immune system problems that are attacking the thyroid. There's also multiple sclerosis, where the brain and the spinal cord are being attacked. There's celiac disease, where the immune system is attacking the gut. There's Addison's disease, where the immune system is attacking the adrenal glands. Pernicious anemia, where the immune system is attacking the red blood cells and your vitamin B12. Myasthenia gravis is another example where the immune system is attacking the neuromuscular junction. And dermatomyositis is where the immune system is attacking your skin. You get all sorts of weird rashes. Raynaud's syndrome is an immune system attack on the joints, and type 1 diabetes is an immune system attack on your pancreas. Now, this is just a small list. Like I said, there's thousands of others. Some of them don't even have names, but they all have a common thread. And today we're going to tell you how to treat those using metabolic and neurological protocols. So how do we successfully treat these conditions? We use proper metabolic protocols and nutrition. We're going to talk about, proper metabolic protocols and neurology. Let's talk about each one of those. Let's start talking about metabolic protocols in autoimmune conditions. And just like I said before, all that big list that I just shared with you isn't an inclusive list. There's thousands of other names of diseases you could put in there. They all come down to very specific things that we're going to talk about today as far as treating them metabolically. So let's start with complete blood work. Now, people with autoimmune conditions come into this office, they've had blood work done. They've had extensive and expensive blood work done. Some of it's come back normal, some of it hasn't. But we'll talk about your individual case when we meet together in the office. But first of all, there's a big difference between lab ranges and what we call functional ranges. Lab ranges can be clear out here, okay, and functional ranges are clear in here. Now the problem is that in order for your optimal health, your lab ranges have to fall into this area. If they fall in between the two areas, your lab range is still normal, but you're still a very sick individual. Let's use thyroid stimulating hormone for an example. And don't quote me on this. I don't know these off the top of my head, so don't go and look it up and try to prove me wrong here. But lab ranges, I believe, for thyroid stimulating hormone are somewhere between 0.5 and 4.0. So that's a pretty broad range. Okay? Functional ranges is much narrower. It's like 1.0 to 3.0. So you can have a lab range of 3.5. Your lab test is going to come back normal, yet you still have a thyroid condition because thyroid stimulating hormone is out of functional range. So we need to look at the lab works that you've had done. We need to look at them functionally to see if they fall within that narrow functional range. So we start doing that with complete blood counts. CBC is what they call them. We need to look at all your red and white blood cells and see if they're elevated. We need to look at chem panels. Chemistry panels are pretty common in the medical world to order to assess different areas of your body, such as your adrenals, your kidneys, your liver, etc. We need to look at lipid panels. Okay? Lipids are your cholesterol. We've all heard of good and bad cholesterol. We need to look at those panels. We also need to assess your vitamin D levels. People with autoimmune conditions, your immune system sucks up any available vitamin D that you have, doesn't leave a whole lot left for the blood, and so your vitamin D levels are probably low. We need to look at C-reactive protein and homocysteine to see if you have inflammation markers that are high that could be affecting your autoimmune condition. Now, this one is very important. We need to look at your immune panels. This is not a very commonly ordered test, but in the case of autoimmune conditions, we absolutely have to know what's going on in your immune system. There's two parts of your immune system that are major players. You have Th1 on one side and Th2 on the other side. Th1 and Th2 are what we call regulatory cells that help the immune system do its job correctly. One of them tells the immune system what to eat and how much to eat, and the other part of it tells your immune system when to stop eating. So you could become Th1 and Th2 or Th2 dominant. So if you have Th1 and Th2 up here, you're going to have an autoimmune attack, and vice versa. Th2 here, Th1, you're going to have an autoimmune attack. Now, the only way to know which side is which is just to run the test. And again, this is not very common practice. I've yet, in the 4 years I've been here, I've yet to see someone coming through the office with a complete immune panel that we need without us having to order it. So this is something we need to look at to address your immune system and how to fix it. Now, how do you fix a Th1, Th2 balance? That all comes down to nutrition and proper metabolic protocols and supporting the immune system using the things your immune system needs, such as, I mentioned vitamin D. You have to have vitamin D for your immune system. I mentioned there's another substance called glutathione. Glutathione is a very strong, it's the mother lode of antioxidants. Okay? And the last thing is omega-3s. Omega-3s come from krill oil. You can get them from fish oil. We use krill because the fish is high in omega-3s because it eats krill. So we just cut out the middleman, use the krill oil. Those three things will help modulate your immune system and will help us to balance out your immune system so that your condition can improve. Now, that's all the blood work. Okay? From here, we need to talk about sensitivity testing. Sensitivity testing is a stool test that we do to determine whether or not you are sensitive, and there's a big difference between sensitive and allergic. Okay? Allergic reactions are things that cause your throat to swell up, send you to the hospital. Sensitivities are things that cause your immune system to go out of whack. Now, we're going to run a test to find out if you're sensitive to gluten, eggs, soy, yeast, and milk. Because if you're sensitive to any of those things, it's making your condition worse. So if you're sensitive to them, and the only way to know if you're sensitive is to run the test. And you probably, when I said gluten, you probably said, well, I've already had the celiac test done. Well, that's great. The celiac test is, and the serum, the blood gluten sensitivity test is not very accurate. They have a high false negative rate. If you're positive, that means that you probably are sensitive to gluten. But if it's negative, I've still seen people. In fact, I had a lady come back the other day. Her blood tests were normal, yet her stool test for gluten was off the charts. It was the worst one I've ever seen. Anyway, my point is, if you're sensitive to any of those things, it's making your condition worse. Now, gluten is a protein found in wheat, rye, oats, and barley. I have yet to see a chronic condition come through this office that was not sensitive to gluten. So it is a major player in autoimmune conditions. Now, the next thing we need to check from stool is something called the Metametrix stool microbial profile. What this test tells us is that if you have a bacteria, fungus, mold, or yeast that's driving your immune system. When you have an autoimmune condition, you have something called an active antigen. Those antigens can be food, gluten, eggs, soy, yeast, or milk, or they can be a microbe, and that's what this test is going to tell us what it is and how to get rid of it. So you can see that we leave no stone unturned when it comes to determining the exact cause of why you're having an autoimmune condition. Now, the next test I want to talk about is called an adrenal stress index. This is a saliva test that is going to allow us to address what we call cortisol. Your adrenal glands sit on top of your kidneys, and they secrete a hormone called cortisol. Cortisol is a stress hormone that's elevated in times of stress. It also helps to regulate sugar. If you're under stress, and I'd like to show, please show me someone who's not under stress, but this test is an absolute must if you're under stress or if you have any difficulty sleeping at all, or if you feel fatigued during the day. We have to run this test to address your adrenal glands, find out where they're at, so that we can treat them with proper metabolic protocols so that you can get better the fastest. Now, That's the metabolic side of autoimmune conditions. It's all about finding what's causing the immune system to go crazy, how the immune system is out of balance, and using the proper nutritional protocols to balance it out and regulate it. Okay? There's a second half to this. There's a metabolic half. There's a neurological half. Let's talk about the neurological side of things. We use what we call brain-based therapy here in this office. As a chiropractic neurologist, I'm trained to hunt down areas of your nervous system that aren't functioning the way that they should and apply specific brain-based therapy to those areas to help you get better faster. Now, your brain is just like a muscle. If you exercise it, it will get stronger. If you don't exercise it, you're going to lose it. So what our job is to do brain-based therapy to find the nerves that have been affected by your autoimmune condition and help start to repair them. One of the best ways that we can do that is with what we call exercise with oxygen therapy, where your brain needs two things to survive: fuel and oxygen. Fuel comes from fuel and activation. Fuel comes from glucose and oxygen. So we're going to use oxygen therapy here in this office. Specifically, we're going to use exercise with oxygen therapy, where you're hooked up to oxygen, you're breathing oxygen in through your nose, and you're pedaling a hand bike like this. Okay? This has been shown to fire cerebellum pathways, making the cerebellum stronger, giving you more energy, better coordination, better balance. These are all things that will determine when you come into this office and we have a look at your specific case. Other things we use are things such as sound therapy. If you listen to sound in one ear, it's going to be interpreted by the opposite side of the brain, and that helps make pathways stronger. Auriculotherapy, we can provide a very mild electric shock to the outside of the ear that is sent through the brainstem to the opposite side of the brain, and it makes that pathway stronger. These are just few examples. There's many, many more examples that we could use in this short video. But the point is that there's a lot of things we can do here to help repair the damage to your nervous system that's done by this autoimmune condition we have. The only way to find out, again, for the metabolic side, is to do the testing. On the neurological side, we need to start with a specific, what we call a functional neurological exam, where we have a very hard look at how your nervous system is functioning, so that we can apply specific brain-based therapy to help your condition better. Now, that is about 15 minutes of me telling you how we treat an autoimmune condition. I just want to remind you, I don't care what the name of the disease is. Okay? I read off a big list at the beginning of the DVD. No matter what the name of the condition is, there is a common thread. There's a metabolic side of it, there's a neurological side of it that we need to find to help us assess you and your particular condition so that you can live life to the fullest. Now, what I want to do is I want you to ask yourself these questions. Number one, how has your autoimmune symptom affected your job, your relationships, your finances, your family, and other activities? Number two, what has your autoimmune condition cost you in terms of money, happiness, and sleep? Number three, where do you picture yourself in the next 5 years if you don't get this condition taken care of now? And number four, what is it worth to you if we could improve your condition? What is it worth? Is it worth giving up wheat? Because I'm going to tell you right now, if you come into this office and you're not willing to make major lifestyle changes, don't waste your money, don't waste my time. I'm not trying to be rude, I'm just saying it's going to take a major lifestyle change in order for you to get better. It's something that we can do. It is a doable thing, but once we have the proper information to help us determine exactly what's causing your autoimmune condition, we need to make the proper lifestyle changes to get rid of those active antigens. Okay? Now, your next step, I want you to watch this video a couple of times. There's a lot of information in here that I really shoot through very quickly, so I want you to watch it again. And the last step, of course, is to call the office, make an appointment, and let's have a look at your condition specifically, so we can determine whether or not we can help you whether or not we can accept you as a patient, and whether or not we can help change your life. Thank you, and we'll see you in the office.